is it visible? Is it visible, ma'am?
Yeah, visible.
Okay, very fine. Good evening to all. First of all, before beginning, Vande Guru Parampara. Salute to all my gurus who helped me to reach here. And let's get into the topic without wasting the time. Yoga in gynecology and obstetrics. As an introduction, yoga, as all of you know, it's rooted in the ancient Indian philosophy as a spiritual discipline focused on harmonizing the body and mind. The word yoga itself means to unite or join, signifying the goal of unifying individual consciousness with a universal consciousness. And it aims to promote overall well-being, reduce stress, and foster self-realization. It offers numerous benefits in gynecology and obstetrics, particularly during pregnancy and postpartum. Not only in pregnancy, not only in postpartum, even at the beginning of the moment when a couple think about a child, they want to conceive, the role of yoga is there. But still now, the topic of yoga in obstetrics and gynecology is remaining underrated. Most of the people are unaware about this concept of yoga, how it helps. Even if they know, they are not ready to take up the journey. And also there are lack of registered prenatal yoga trainers among the yoga field itself. That is a sad truth. So let's begin with the yoga for preconception or preconception yoga. How do yoga poses boost fertility? A healthy body and a calm mind are the prerequisites for increasing your chances of getting pregnant. Yoga is a wonderful way to boost fertility as it allows you to have a holistic approach to strengthening and conditioning your body. It affects both the physical and mental aspects of health. Actually, the yoga helps a woman to prepare herself physically, emotionally, and spiritually for the conception. It helps to reduce her stress levels, increases the blood circulation levels. Some may be having some hormonal imbalances like some conditions like PCOD, which is more common nowadays. And the yoga, in the beginning, if one lady practices, it helps to control her hormonal imbalances, even if she is having some diabetic issues or some thyroid issues, whatever it be. And it keeps the ovaries healthy. It helps the women overcome any barriers and fears they may have in the preparation for having a child. It increases her pranic level, vitality, and opens energy blockages. Here I am mentioning some of the yogasanas for conception. This is a very short list. She can practice Marjariyasana, the cat posture, Chakki Chalanasana, Malasana, Upavishta Konasana, Ardhamalsendrasana, Janushishasana, Sedbandasana, Pavan Muktasana, Paschimottanasana, butterfly pose or Titalyasana, Mandukasana, Padahastasana, Padmasana, Vibrida Halasana, etc. Not only the asanas, even the breathing pattern also plays an important role in the preconceptional stage. Even if the woman is having a BP issue or any cardiac related issue, some sort of pranayama practices helps her in this preconception stage. According to a person, the inclusion of the asanas and pranayamas or whatever the practices varies. In general, I'm just telling these things, but it is not same for all. Every person is unique. So the protocol which we follow for each and every person is also different. We can include Nadi Shodhana Pranayama, commonly known as Anuloma Viloma, Brahmari Pranayama, Ujjayi, Kabalvadi Pranayama. Now let's look into the concept of mudras, which is not commonly practiced, but mudras plays a very important role in conception as well as during the pregnancy also. Regarding mudras, mudras are hand gestures that help the flow of energy within your physical and emotional body. Used in conjunction with yoga postures, meditation, and breath to help stimulate the flow of energy to different parts of the body. It helps balance the functioning of the reproductive system. Easy to perform. That is the main and most beneficial part of regarding the mudras. We don't need a mat. Just by even sitting in a chair in a calm place where we are, we feel free to be performing this. We can perform it anywhere, whether sitting or standing, whichever position you are comfortable, even though we prefer doing mudra practice by sitting. Some of the mudras we practice for preconception care is Yoni Mudra, Shankha Mudra, Vayu Mudra, and there is Usha Mudra, Surabhi Mudra, etc. The list goes on. Now, let's get into the most beautiful stage, the pregnancy stage. Pregnancy is a precious and important event in a woman's life. Every woman wants to enjoy the event in her life and wishes to bring a healthy baby to this earth. But unfortunately, there are many obstacles in enjoying pregnancy, especially at the time of delivery because of the physical and psychological factors. Nowadays, the major problem is stress. Everybody is stressed out, no matter whatever be the reason. Some will be light, some will be very big issues. Stress is everywhere with everyone. Scientifically, it's proven that stress affects the psycho-neuro-immunological aspects. Today, medically, it's proved that yoga is greatly helping the expectant mothers to manage their stress and minimize most of their problems. Hence, prenatal yoga was designed to practice during the time of pregnancy. It is just one ancient yoga method, but there are some modifications and changes in techniques to meet the demand of pregnant women these days. Yoga is not only helpful during pregnancy, but also before conception and after delivery, which we have already done the preconception yoga. What is a mindful pregnancy? Pregnancy is a time of complex changes and growth. Yet, some of the most profound changes are the ones you can't see. Your inner world of emotion shifts constantly, but approaching your pregnancy in a mindful way will benefit you and your baby as your thoughts and emotions flourish with more ease and less anxiety. Mindfulness will nourish and nurture you as you learn to pay attention to your current experience. It will allow you to fully connect with your heart, mind, body, and the baby in this incredible journey of pregnancy. In general, the pregnancy yoga is otherwise called as prenatal yoga. It depends upon the months. No, actually, we give pregnancy yoga depending on the week of the pregnancy. In general, what are the physical benefits of prenatal yoga? It improves blood circulation, improves digestion, develops stamina and strength, improves hormonal system, calms down nervous system, reduces musculoskeletal strain and pain, prepares the body for labor, keeps both mother and baby healthy. Not only physical benefits, some emotional benefits are also there. It helps in the deep relaxation for the mother. It reduces her stress and anxiety and keeps her feels some good factor is always there. It increases her confidence and self-esteem and helps to get rid of her all sorts of fear which a woman can commonly experience during her pregnancy stage. And moreover that it helps her to connect with her baby. Let's look into what all we can do in the first trimester. That is from till the 12th week. Even before starting any sort of yoga practice, we have to take care of something. That is the precautions. Even for a normal person, we take care of something while just before beginning the yoga practice. So, but we all know that pregnant women, we have to, that Tailapurna Kumbha, like we have to carry her very delicate, right? So that is more, we should be more cautious in the prenatal yoga practice for her. As a general precaution, we should not allow her to overstretch while doing yoga practice, or while doing pranayama also. Don't allow her to hold her breath. Advise her to drink a lot of water. Just allow her to move slowly and mindfully in each and every pose. Avoid any poses that causes her discomfort. Start the practice slowly depending upon the person. Each pregnant lady is unique. Avoid most bounded poses that is causing more tightness in the pelvic and abdomen area. Avoid pranayama with rapid breathing or breath retention. Even in preconception stage, we advise Surya Namaskara. But while coming into this prenatal yoga, we will have some restrictions regarding the Surya Namaskara. And also regarding this pranayama, the fast food, something like Bastriga, Kabalwadi, we don't recommend for her. Also, avoid abdominal exercises, forward bending with legs together, as it may cause some extra strain in her ligaments and tendons. Avoid prawn poses. And the most and primary thing, consult a doctor before starting yoga. But now also, many of the gynecologists or obstetrics who are unaware of the importance of yoga in the prenatal stage, they won't allow the pregnant lady to practice yoga. And the contraindicated poses, mainly the inversions, that is Adho Svanasana, the downward facing dog, Sedabandhasana, Viparita Karani, Sarvangasana, etc. Also the Ashtanga Vinyasa series. If somebody knows about Ashtanga Vinyasa series, let me give a brief introduction. Ashtanga Vinyasa series, I'm also completed Ashtanga Vinyasa TTC. What I have felt is Ashtanga Vinyasa, the Vinyasa pattern is the most toughest one to practice. So it will be better. The pregnant lady can avoid that series. And sun salutation, interns, back bends, prawn poses like in Bhujangasana, Shalabhasana, Dhandrasana, etc. Deep twists like Ardha Matsyendrasana, spinal twist, jump and jerky movements. Abdomen strengtheners like holding the Naugasana or Navasana, Kapalbhati Pranayama, Bastriga Pranayama, or even in Nadi Shodhana, just allow her to do the inhalation and exhalation at her own pace, but prevent breath retention technique there. What are the beneficial yoga poses? She should be able to do most of the basic yoga poses that will help her a lot in her journey. Coming to the standing series, we can include Kadi Chakrasana, Ardha Kadi Chakrasana, Tiryak Tadasana. When coming to seated poses, Baddha Konasana, Titalyasana, Chakki Chalanasana, Vajrasana, Virasana, Janu Shirshasana, Paschimottanasana, Parshva Sukhasana. When coming to restorative poses, she can practice Ananda Balasana, Supta Virasana, Supta Sukhasana. Now, let's look into the second trimester from 13th week. The precautions are same as that of the first trimester. Start up slowly after inactive first trimester. For some ladies, usually the doctors just take bed rest for the first 3 months. So they won't be active that much at that time. Also, even if it is a primey, she will be having more fear than other ladies. So for such persons, start the practice very slowly. Avoid lying on the back for more than 30 seconds. Avoid inversions, unsupported back bends, deep stretches and twists, arm balance poses, or intense or advanced yoga poses. Also, avoid prone poses, which we have already mentioned in the first trimester, and forward bends with legs straight. You can do with a knee slightly bent to avoid hamstring stretch or hamstring strain. Avoid anything that doesn't feel good for her. Be more careful with women carrying twins or triplets. It is this precaution, this last thing, that is, be more careful with women carrying twins or triplets. We have to keep in mind from the very beginning, from the very first week. Regarding the contraindicated poses, inversions, Ashtanga Vinyasa series, sun salutations, deep back bends, deep poses, prone poses, supine poses can be practiced, but not more than holding for 30 seconds. Avoid jumpy and jerky movements, abdominal structures. Regarding pranayama, avoid Kapalbhati, Bhastrika, forceful breathing, breath retention, any pranayama. Coming to the beneficial yoga poses in the second trimester, regarding the standing poses, you can include Trikonasana, slightly we can do Kadi Chakrasana, Tiriktadasana, but according to her range of motion. Always keep that in mind. We can include Virabhadrasana 1, 2, and even we can include 3 with support. Vrikshasana, Ardha Chandrasana, Parikasana, Ardha Uttanasana. Actually, these standing poses helps her to build a very good strength in her legs. It increases circulation to prevent swelling in feet and ankles. Do balancing poses with support. And in this trimester, chest openers and hip opening asanas will be much beneficial, which help her more in her in the progression of the pregnancy journey. Coming to sitting poses, you can do in normal Sukhasana, do Viparita Namaskar and Gomukhasana, not by crossing the legs, but only with the help of hands. Baddha Konasana, Titilyasana, Vajrasana, Janushishasana, Virasana, Paschimottanasana, Marjaryasana, Parsha Sukhasana, Parsha Vajrasana. That is to one side only, with one leg only. You can keep the other leg straight. Parshva Janu Shirshasana, slightly bending to one side. Udara Karshanasana, like windshield wipers. Some may confuse it with spinal twist. Not that much twist we need to do. She can do windshield wipers like Udara Karshasana. Coming to restorative poses, Ananda Balasana, Supta Virasana, Supta Baddha Konasana. Supta means by lying down. But by lying down means here we can take the support of props I will come later. And then legs up to the wall pose. Makarasana on one side, same with Udara Karshanasana. Inversion, Sedubandhasana. Vibrita Karni and Sarvangasana we have told as a contraindicated in the inversions, but we can do to halfway with support of the props. Let's come to the last trimester. Precautions same as the second trimester. Avoid lying on back, avoid inversions, binding postures, unsupported back bends, deep stretches, twists, unbalances, advanced poses, avoid prone poses, etc. Contraindicated poses are also same as that of second trimester. That is complete inversions, bounded postures, deep twist like Ardha Matsyendrasana or Malsyasana also we can do with support only depending on the lady. And let's come to the beneficial yoga poses. A teacher can guide a student to explore poses that help her relax, but also find strength. This will serve her during the intensity of birth, that is during the labor. The biggest concern with asana in the third trimester is protecting the joints and maintaining balance, because as we all know that coming to the third trimester, the belly will be big and the body weight will be increasing. So mainly she will be affected with pain during in the knee joint and ankle joint. Even if she was already having some PCOD issues or obesity issues in the preconception stage itself, or while during the marriage itself, it will become a more worse concern as her body weight will be increasing, and also that because of that fluid and all. Also, she will be finding difficulty for maintaining the balance, especially if the lady is having a flat foot or if she is having a plantar fasciitis. Because of the loss of the arch, she will be feeling difficulty in maintaining balance at this trimester. She can include basic standing and balancing poses, Trikonasana, Parshvakonasana, Virabhadrasana, 1, 2, and 3, Parshvattanasana, Vrikshasana, Ardha Chandrasana, Parikasana. Parikasana means gate pose. While coming to seated poses, she can practice Baddha Konasana, bounded angle pose, Titalyasana, butterfly pose, Chakki Chalanasana, Upavishta Konasana, Virasana, Malasana. Malasana is a very beneficial um, uh, asana practice, because if she is not having any cervical length issue and everything is normal, sitting for few seconds at least in the third trimester in the Malasana, or when approaching the term date, it will help her in getting into normal delivery. Marjaryasana, Parshva Sukhasana, Parshva Vajrasana, Parshva Janu Shirshasana. When coming to restorative poses, Ananda Balasana. Ananda Balasana, some ladies will be having difficulty for practicing, but she can use props. And another benefit of Ananda Balasana is it relaxes the spinal region, especially the back region. She will be feeling very relaxed. Supta Baddha Konasana, Supta Sukhasana, legs up to the wall pose. It helps to draining of the excessive swelling or edema if she is having in the feet. Magarasana on one side. It is by placing a pillow as a supportive thing. And Uddara Karshasana. Inversions also same. Sedabandhasana, she can do up to a, not lifting her hip very high, but as long as she can raise it, she can do that. And Viparita Karani and Sarvangasana, she can go for halfway with support. And the Shavasana. Normally we tell the pregnant lady, don't lie on your back, lie on your side. So while practicing Shavasana also, she can lie on her side. She can take the support of pillow or bolster, or a blanket, folded blanket in between her knees as a support for the belly, as support for head. Even the C-shaped pillow also works here. That is that with the help of props. Actually, while practicing the prenatal yoga, props play important role. Even in normal yoga practice, we use props like yoga belt, ring, bolster, and even pillows, blankets, knee pad, etc. just for alignment, because the anatomical structure of each person is different. So some may need props, some will be super flexible. So they even don't need props for their practice. I say they are lucky persons. Even some of us, even I may struggle in some poses, because the use of props helps to attain a better alignment and a better posture. So in prenatal yoga, throughout the journey, we use props. And just coming into the importance of meditation. Before that, I have just mentioned the use of props. Even now, we have completed the 3 trimesters. Some of you may have a doubt. All these postures are, or some of these postures may be difficult. How can a pregnant lady practice this? One, I said with props. Second one, normally all these practices, the pregnant lady won't do by sitting on the ground on a mat as normal persons do. We used to give the sessions using a yoga chair or that birth ball, right? A gym ball like thing, according to her height, and using blocks or using pillows by sitting on whatever be the comfort, whatever she feels comfort, where she feels she can sit comfortably. Even the balancing or standing asanas, we use the props like a yoga belt or yoga blocks, which helps her to reach to her level where she can stay comfortably in that asana. And we are not holding that asana for too much for a pregnant lady. Now let's come into the importance of meditation. From the preconception stage, the meditation, I have earlier mentioned that now what most of the people face is stress. The psychosocial factor is um, very much torturing many of the people nowadays, especially when coming into a pregnant lady. It is playing a more severe role. So meditation helps a lot for calming her mind to deal with her stress and all. It helps to reduce her stress and anxiety, reduces depression, slower her pulse rate. Some ladies feel palpitation and increased heartbeat and all. The meditation helps, or the pranayama techniques, when done in a slow and guided way, will help to reduce these problems, and it helps her to increase her calmness for a better sleep. Most of the ladies struggle for a better sleep during the night. So the practice of meditation regularly will help her for a better sleep, helps in lower blood pressure, increases the acceptance of self and others, increased self-awareness. It helps in the decrease in destructive behaviors. Some pregnant ladies will be very much angry because of the some raised body temperature and all. But meditation and also cooling pranayamas will help her to calm down. Improved ability to focus and concentrate, improved a positive outlook. It most importantly, it helps her to connect with her baby, helps with labor. It makes an easier day for whatever pregnancy throws her way. She will be facing a lot of issues, right? Both physical, mental, from the society, even from her own family. So she will be able to cope up with all these things through these practices. Now let's come to importance of Yoga Nidra. I don't know how many of you are aware of Yoga Nidra, because meditation is a common thing many knows. Yoga Nidra is at another form of yogic practice, which is mainly intended for relaxation. Um, that is why, and that is how I can tell in a simple terms. It is a deeper stage, but it mainly means a relaxing stage. Yoga Nidra is a deep relaxation form of yoga, a yogic sleep through which subconscious mind is accessed while being in the complete state of rest. Yoga Nidra is a systematic method of inducing complete mental, physical, and emotional relaxation while maintaining awareness at deeper levels. It is an instrumental in experiencing a more relaxed childbirth. It helps a mother cope with the physical and emotional journey of labor and also at the time of delivery. Like all other practices, the positive affirmations that mother can tell to herself, because as we all know, our thoughts will some form into reality, right? So if we are practicing positive affirmations during the pregnancy, it will pave a great way for her childbirth. Positive affirmations are specific statements that help you overcome negative thoughts and create new pathways in the brain for positive mental, emotional, and physical changes. Your thoughts can create your reality. The thoughts can help create an awesome, unmedicated birth. Some of the examples of positive affirmation, there are a lot of positive affirmations available. Some I have included is the lady can say to her as many times in a day. There is no limitations that she should tell this much number of times only. I'm so grateful for this amazing pregnancy. It is such an honor to be carrying this baby in my womb. I love honoring my body. I'm grateful for this important role as an expecting mother. My body is a secret temple of love and light. I love my pregnant body. My baby and I are safe. I'm so excited about the birth of my baby. I cannot wait to meet my beautiful baby. These are all about the prenatal yoga. Now let's move on to postnatal yoga. Now the baby is out. Motherhood is such a powerful and overwhelming special experience. After 9 months, the baby has finally arrived and changed her life completely. The morning sickness, achy lower back, and fatigue of pregnancy have passed. But for few mamas, a whole other different set of physical conditions often accompanies the bliss of loving your little creation. She's probably totally exhausted and recovering from the marathon of labor, not to mention waking every 2 hours with a hungry newborn. Luckily, a few simple yoga poses address the most common concern. So, postnatal yoga will help loosen tight muscle, release tension, calm nerves, and calibrate and rebuild the pelvic floor and abdominal muscles that have been tried and tested over 9 months of supporting a little creature. Yoga is extremely beneficial and can help recover from the effects of childbirth smoothly. Now, let's look into the benefits of postnatal yoga. Before that, let's come into the precautions what we should keep in mind while training a postpartum lady. First of all, discuss the lady should take her consent from the doctor before starting postpartum yoga sessions. Perform yogasanas that she can perform comfortably. Don't do any abdominal exercise until she has checked for diastasis recti. If she practice abdominal exercise or severe postures, if she's having diastasis recti, it will lead to much more complications. And she can start her practice with a time duration of 5 to 15 minutes a day at the beginning, and gradually she can build up the practice. Only gentle stretching should be done until there is a substantial decrease in the bleeding. If bleeding increases with activity, decrease the intensity. If she had undergone a C-section, additional considerations should be taken. Full inversions should be avoided if the woman is in bleeding stage. Now, coming to the benefits of postnatal yoga. It helps in quick postnatal recovery, aids in weight loss, helps in building up the endurance, regaining her normal posture, psychological benefits, strengthens the pelvic floor, and it helps her to attain a balance between her new life and her old life. And it also helps in dealing with the fatigue, strengthens the weakened abs. These are all the topics which I have included from the preconception, from the coming to the prenatal and postnatal. Just included the obstetric part. But when coming to the after the post-pregnancy, when we start the pregnancy postnatal journey, postpartum yoga practice to the women, we can include baby also in few sessions as mom and baby yoga. Actually, I give training. I conduct sessions for mom as mom and baby yoga. In that sessions, baby can also be included in the practice. So she won't be bothered about her baby or whether her baby will be crying, or she can attend the session little more calm, and also it helps in making more bonding with the baby. And not as a conclusion, but birth is not only about making babies. Birth is about making mothers strong, competent, capable mothers who trust themselves and know their strength. Thank you. And before ending the presentation, let me stop sharing. Ma'am, I would like to conduct a small meditation session, or will be too tired. So I would like to conduct a small meditation session, which we used to give for pregnant ladies. Usually when the sessions, we do it with a artificial belly by tying a pillow or dupatta or something else on our abdomen. If you're okay, shall we go to a small meditation session which we used to give for pregnant lady? Consider
Yeah,
yourself, consider yourself as a pregnant lady. Imagine that you are pregnant even for male participants also, consider yourself
We
as
ask the participants and let wait for the message of participants. What they, yeah,
yeah.
uh, let them post the message that they are ready to attend the meditation session. Yeah,
So that they will get an idea.
yeah, yes,
It
yes,
is
yes.
how it works.
How to explain? Yeah, how to explain to the female to have meditation. Nah, it's good thing. Yeah, we have got reply from Deepika. Then anyone else want to attend the meditation session to treat your patient or to assist your patients? Do you want to learn? Only Deepika want to learn. Siddha, Jalpa, Sushila, Yamini, just post your message. So that we can know that you can actively participate.
Um, Actually, regarding the meditation and the relaxation, there are a lot of techniques we used to give from the preconception stage, and it plays
Yeah,
another role because now we are not, most of us are not pregnant, but we can feel that how it will
yeah.
be. You are having a baby inside, or when your
Mm.
wife, or if your sister or someone else having a baby.
During pre-conception or infertility cases, also we advise such same
Yeah. Yes,
meditation
ma'am. It is giving
to those
challenges to
patients.
yourself, but most of the ladies are not aware of that. And also, your modern gynecologists are also not, some are
Like
changed
nowadays,
their mind.
yeah, nowadays we are having lot many PCOS, PCOD cases. They are also
Yeah,
asking us
ma'am.
for
I
yoga
have not
practices.
got into that gynecological part because it is also because being an yoga therapist, I have seen the
Uh,
uh, patients with PCOD and obesity. Mostly 95% of the ladies are now having these issues. But if the patient is giving us a proper review, they follow up correctly, they are having tremendous results because mainly stress is an on factor. Especially if they are facing, if they are working in the IT field or in the banking sector also, a lot of work
they
pressure.
are coming to us that kindly give us which yogi practices we
Yeah,
have to follow. Or
even by
yeah,
these yoga practices, meditate, even with simple meditation and the relaxation techniques, the infertility cases are getting better.
yes, nice, nice,
Because
nice.
mind only was the culprit there. Sometimes
Yeah,
in cases, all of the tests will be positive, will be negative and normal. But the only thing which they will be missing is the mind, the mental factor or
yeah.
psychology.
Generally, in all the gynecological cases, stress is the main culprit. So meditation may help in all the cases, right? Yeah.
Also, one more thing I want to say, because there are different systems or different types of yogic practice. There is a practice known as Yin Yoga, which is not widely practiced in our country. That is a practice even we can practice during the menstruation time.
En
Which
yoga.
in yoga, because there even during menstruation, normally what yoga teachers tell to ladies, if you are having menstruation, if you are having severe bleeding, she can take rest, but if she is okay, I'm telling you about the normal lady, uh, avoid yogasanas, avoid yoga practice, you can
Yeah.
do
Yes. 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 Yes.
but
Yes.
if you're practicing yin yoga, she can even practice, if one who is very much interested in practicing yoga can continue her yogic practice even during her menstrual period by practicing yin yoga. It is done using mainly props, and it also helps a lot. It is also a meditative state of yogasana practice. I can say like that. We will go into
Good.
meditation
Uh,
in yoga practice, in asana practice.
Yeah, those are different asana, different yogi practices or something else.
Ma'am, actually, we tell Stiram Sugamasana, right? Asana's
Okay.
definition.
Yeah. Yes.
That
Yes. Yes. Yes.
posture which gives us comfortable and
Mm.
that we can hold for a long time without any difficulty. Actually,
Yeah.
in yoga, we hold a posture even for 3 minutes without any
Mm-hmm.
using props.
Yeah. Yes. 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 Yes.
Actually,
Yes.
from my experience, I have felt that in yoga is the actual yoga one can that describes that definition, Stiram Sugamasana.
Okay. Okay.
But
Okay.
that is
Okay.
not widely practiced here. I think in European countries it is
Okay.
there, but here it is. Most of
Okay.
the teachers are also unaware about it, and most of the teachers are also unaware about the prenatal yoga, postnatal yoga, and all
Okay.
yoga therapy,
Uh,
everything. Actually, yoga therapy and Ayurveda goes hand in hand if the patient is
okay.
willing.
Okay. Okay. Mm. So it's very means you are advising different asana in that and yoga.
Yeah, actually, ma'am, what is my motto means, uh, I have studied many courses, I have studied under many teachers, but what I felt is if one approaches me with something, some issue, I can't give the traditional yoga practice. I should give him or her an alternative suggestion if possible. There are a lot of
Mm-hmm.
ways we go on seeking. That is how I kept studying like this and go to know many varieties of yogic practices.
Mm-hmm.
For example, if uh, considering a old lady who can't do yoga practices, we can give mudra therapy for her.
Okay.
Even in the menopausal stage, it is at another topic. In the menopausal stage, she can practice this in yoga, this mudra therapy, meditation, pranayama, that gentle yoga movements, yoga nidra techniques and all.
Can you explain what is that and yoga?
Pardon?
What is that and yoga include
Ma'am, that is
in
what I
yoga? In yoga.
yeah,
Yeah. Mm.
in yoga include yin and yang. It is a like energy, chi energy flowing. It is a deep topic. It works mainly on the meridians of our body.
Okay.
In that
Okay.
also, it is the asanas, but there we take one asana practice for we will be there in the asana, one asana for nearly 3 minutes. We can go with
Okay.
ease. But in normal yoga
Okay.
practice, we can hold a asana for 3 minutes, right?
Okay. Now you can start to explain how to do meditation and explain how to patient. Yeah. Every time you can start that meditation session. Yeah.
Okay, now let's get into a small meditation session. First of all, everyone should consider yourself as a pregnant. That is, you are carrying a baby in your womb. Okay, now the session can be interactive. If at least some thumbs up, will do great.
Yeah.
Okay, now let's get into the meditation. Sit comfortably
Yeah.
wherever you
Yeah.
are.
You tell them how you will going to explain your patient. Yeah. Then they will uh,
Yeah,
give reply.
now
Yeah.
you are our clients. Now I will instruct you just sit wherever you are. You can sit in a chair. If you can sit cross-legged on the mat in the ground, that is also fine. If needed, you can take a wall support. Uh, Sit comfortably till the meditation ends. Just sit by, closing your eyes. Follow my instruction. That's all what you need to do. So everyone ready? Let me start. Sit in a nice, comfortable position. You could sit on a cushion for elevated sitting stance, or if you have slight painful hips at the moment, you can take a wall support, fold your legs in a way that the knees are facing upwards. You can sit comfortably wherever you are. You can take a few seconds time to sit comfortably, as the videos are not on. I couldn't see anyone. Sit with your spine erect. If possible, you can switch on your videos. That will be fine for the meditation, so that I can guide you. Okay, sit with your spine erect, hands resting on the thighs, palm facing upwards or under the bum, palms placed on top of each other, and close your eyes. Place one of your palm above your belly and one of your palm below your belly. All of you are pregnant, right? So you can keep your hands like that. Take a moment to breathe in and breathe out. Just keep a natural breathing pattern. No stress, no force to breathe. Now, listen to the silence around you and keep a smile on your face. Continue deep breathing. Now, slowly start deep belly breaths, deep inhalation and exhalation. When you inhale, inflate your stomach. Let it expand a little more, releasing through the pelvic floor. While you are exhaling, you're going to draw your belly button and your baby towards your spine. Feel like you're hugging the baby with your tummy muscles. And at the same time, you're going to lift up the pelvic floor, which is a very gentle sensation. It's almost like you are holding your vaginal muscles in. Inhale, you expand. Exhale, you're hugging the baby, lifting it off the pelvic floor. Inhale, you expand. Exhale, you're hugging the baby, lifting it off the pelvic floor. Now, slowly take your hands to the belly and observe the sensation in the movement as you inhale and exhale. The expansion and contraction of the belly. Keep your breath nice and easy. Deep, really long, as much as you can expand your lungs. Continue deep breathing. Now, just observe your belly and the feeling of your baby move and respond. Listen to the breathing and relax your shoulders. Relax. Continue deep breathing. Observe your baby moving. Feel that blissful state. Now you can make your breathe little bit more longer and deeper. Observe the inhalation and observe the exhalation. Now we are taking long, deep breath in and a long, deep breathe out. Now slowly return back to your natural breathing. Slowly return back to your natural breathing. Relax all your facial muscles. Relax your shoulders. Feel the rise and fall of your chest. Listen to the silence around you. Join the space in the present moment with the little one inside of you. Connect with your little one. If you are in a cross-legged position, gently swap your legs, keeping your eyes closed. Now gently start to rotate your head in circles, nice and easy. Feel the tension releasing while you are moving head to all the sides. Breathe in when you push your head to the top and breathe out when you push your head down. Just 2 circles is enough, and reverse the direction nicely and slowly. Once you're completed, slowly return back to the center. Move your upper body in the way you would prefer to gently sway to the sides and the back. Go along with the rhythm of the breath. Move your upper body in the way you would prefer to gently sway to the sides and back, and slowly come back to the center with spine straight. Breathe in and breathe out. Take another long deep breath in and breathe out completely. Observe the sensation in the moment as you inhale and exhale, the expansion and contraction of the belly. Keep your breath nice and easy, deep, really long, as much as you can. Expand your lungs. Continue deep, long. Breathe in and breathe out. Continue deep breathing for a few more rounds at your own pace, at your own rhythm, at your own comfort. Now slowly lift the hands off the belly and just rotate your wrists nicely and easily 3 times with natural breathing in and out. Rotate your wrist 3 times clockwise. Connect it with your breath. Once you are done with 3 clockwise movements, continue with anti-clockwise movements. Once you're done with the wrist rotations, take a deep inhale through your nose and exhale through your mouth. Take a deep inhale through your nose and exhale through your mouth. Continue this for few rounds. Inhale through your nostrils. Exhale out through your mouth. Just be thankful for this day and just be mindful of the moment of your baby inside of you. Gratitude. Now, slowly release the legs forward and keep the legs straight. You can place your hands beside your hips and slightly tilt your chin up to the ceiling. Nicely breathe in and out. Breathe in and breathe out. Now slowly come back to the surroundings that you are in. Become aware of your legs resting on a mat. Become aware of the hands. Push to the mat below. Now slowly become aware of your surroundings and rub your palms together and place it on your eyes. Rub your both palms together and place it on your eyes. Feel the warmth. Feel the darkness. Appreciate the darkness with a beautiful smile. Now, looking through the gaps of the fingers, slowly open your eyes with a bright and beautiful smile. Those who have practiced, how you feel? Everybody slept.
Yeah, quite relaxing. I think everyone slept.
In meditation sessions, usually it happens, ma'am.
Yeah, it's
We go
usually
into
happen.
sleep
Yeah.
because I conduct meditation workshops for normal people.
Mm.
Some people go to sleep.
Same meditation we can advise or do to other patients also,
Yeah, with
or
slight
only
changes.
only only for this was only for pregnant ladies, or other can also do.
Actually, this particular meditation is for pregnant ladies. You can give it to others also, but there will be some slight changes in the instructions because here we are instructing to keep the hands on the bum, right? We are instructing
Mm.
to keep the feel the movements of the baby in between. Actually, there's a small meditation. Some different types of meditation is there. We can give for normal people. We can give for pregnant ladies. Even in preconception state, also there are different types of meditation, relaxing. All we can create
Yeah.
situation.
Like fertility enhancing meditation, can you suggest some? Because lot many infertility patients are always in stress. So, which type of meditation we should advise to them, or some yogic practices which we should advise them?
For infertility cases, mainly, ma'am, it depends upon the state of the couple. Not only for the lady, but for her husband also we have to give. because his mental and physical support is also very important in infertility cases, right? So
Yeah.
not we can't tell this type of meditation because there are various types. For the basic thing, the meditation should be guided because it should be done only under the guidance of a
Guided meditation.
practitioner.
Yeah.
Yeah, because we can't say even for the stress and anxiety cases, we advise guided meditation only because then
Mm.
only we can feel what mental status they are. Because in some meditation sessions, they will go deeper. In yoga nidra and all, they will sometimes sleep and go into deep sleep state. Some may cry, some may shout
Yeah,
out.
yeah. That I have seen. That I have
Yeah,
seen. Some may
it
cry
happens.
during
So
meditation.
we can't
Yeah.
tell
Yes.
this for this, no, but should be guided. That is the basic thing. And we can change that instructions and all as per the condition of the couple or the patient. Depends
And
because some
what do
and some
you
may be
think?
trying for only last 1 or 2 years for the baby. Some may be trying for years, 10 to 15 years. Their mental status will be different. Usually, the prenatal yoga, what we give is based on, I have told it earlier that not based on the months. It is based on the that week of the pregnancy and all. So it depends
Yeah.
from
Yes. Yes.
from
Yes.
person to person. The same is with the infertility cases also, because
Mm-hmm.
my suggestion is that one-to-one sessions are better. So we can
Mm-hmm.
take care of them much more. They also will be much more cooperative. Otherwise, uh, s- there may be even small issues are enough for them to lose their mind. Already they will
Yeah.
be fed up with the treatments and all, and the curses from their family, the society and all. So we have to take care of them at the basic level.
Yeah. Right. Right. Right.
It
Right.
varies per
And
person. We can't tell if this is for that.
Mhm,
Help.
mhm. And in during Garbha Sanskar sessions, same meditation we can advise to patients. This which you explain now.
Yeah, but be aware of, be cautious about that instructions because here we have done for a pregnant lady, right?
During Garbha Sanskar, do we do to pregnant ladies?
That
No.
is Garbha Samskara also can do in, I meant
Mm.
for preconception stage. Sorry.
Yeah, during pregnancy we advise.
Preconception, there will be slight different. We have to change the.
But yeah.
There are a lot of methods. This is just a
Mm,
simple one so that you can feel how it. Even for normal people, just meditation, if they have practiced well, even after, especially after a tiring day, it will help them a lot. That is why I asked you
mm,
for
mm, mm,
feedback if someone practiced it.
mm, mm, mm. And what do you think about this Garuda Asana?
Uh, Garunasana, ma'am, if the lady can balance herself, she can practice. Otherwise, in normal stance, she can just practice it with that hand posture, no? That
Mm,
bounded hand posture. That simply will
mm,
work. That is enough for her.
mm. Okay. And any specific asana particular in relation to specific gynecological issues have you observed giving benefit to the females?
If in case of obesity related to PCOD or something, the hip opening asanas will be better. Also, that spinal twist coming like Ardha Malsendrasana and all can be given.
Mm,
If in case of them, some thyroid issues,
mhm,
Malsyasana is a better choice. It depends.
mm,
We have to first check. All can practice all asanas. Some may seem to be healthy, but when they come onto the mat, the scenario will be different. We have to assess each and every student, how they are, how their anatomy is. That is what most of the yoga teachers don't even care nowadays, that they simply practice what they have learned. The
mm,
yoga anatomy is an important part. Even after
Mhm.
doing so many TTCs, many teachers are unaware of the yoga anatomy. First of all, we should know the anatomy of our own body. Then we should know
Mhm.
about the anatomy of the
Mhm.
student or the patient coming to us. Each
Mhm.
differs. Some may be
Mhm.
some through practice, we can get them more flexible, but some by anatomically by birth, they will be like that only, so that we can't force them anymore in any practice, any source of asana practice. I'm basically telling you about the asana practice. Meditation and pranayama will be most probably common for everything. It won't create much issues, but every yoga practitioner should be aware about the asana practice, the anatomy. The anatomical aspect is very, very important. Being
In some
doctors,
any
take care of that. Being
specific
doctors, we will take care of that, but normal yoga teachers won't take care of that.
Mhm. Any specific asana related to like that different organs like supporting to ovaries, supporting to uterus, like that you advise to patients or not?
We can practice the butterfly pose, Asana, right? It is a very beautiful asana practice. Initially, some may not be able to practice it in a full stretch, because the range of motion will be different as per the according to their pelvic anatomy and as per their hip opening range and all. But by practice, I have seen many can improve the stretches, also the movement, the up and down movements of in the butterfly pose.
Okay.
It works for most of the ladies. Also, Chakki Chalanasana. That is also another wonderful asana. And Nauka Sanchalanasana. All these are benefit in most of the cases.
The Chakki Chalan is beneficial during pregnancy, as I have seen. But
Yeah, I
yeah.
have, but that should be done very carefully. But don't go
Mm-hmm.
in a wider circumference. Just
Mm-hmm.
in Chakichalanasana, what we have to keep in mind is just start from a small circle, then slowly increase. But as the
Increase.
trimester, as the week progresses, the belly will be much bigger. So that if we can place a support under the belly like a folded blanket or one or two pillows and do that, just simple thing we have to keep in mind is give whatever the practice for the patient as per their comfort zone, as per where they feel good. They shouldn't feel bad after
Mm-hmm.
practicing all these things. They should feel good
Mm-hmm.
and they should feel comfortable while practicing. Then only they will come for another session. Then only they will hear us.
Mm-hmm.
It
Yeah.
depends. We should consider all the aspects of that client or patient or student, and then give the asanas as per her comfort level.
Okay, nice.
Because
Now
through
I would
practice we will come to know how long can one can go, or what all things will one student can do or can't do, and all we through practice only we will came to know.
yeah, right. So I would like to invite anyone want to add or ask directly, and they can add in the session or ask something, or they can share their experiences. Anyone want to? Otherwise, I'll invite individual. Anjana madam, namaskar. Deepika, do you want to ask anything? मंजुश्री पूछना है तो पूछ सकते हो.
जी नमस्ते मैडम.
हाँ
हेलो
नमस्ते. हाँ हाँ बोलो.
मैडम, एक्चुअली मैं जानना चाहती थी कि प्रोलास में पर्टिकुलरली कौन सी आसन वगैरह कुछ कर सकते हैं फर्स्ट डिग्री प्रोलास में मैम.
Dr. Dhanya, can you add?
I couldn't get her.
She's asking about uterine prolapse asana. Asana practices in beneficial in uterine prolapse.
Actually, some for every conditions we can give asana practices, but if it is an initial stage and all pelvic floor exercises will be doing, but if it is If it is a condition that had to be, if it is surgically, it should be surgically managed, it should be gone for that. Yoga don't support each and every condition. We used to,
Okay.
even some issues are there, do Kegel exercises, do pelvic floor exercises. That helps to an extent. And depending upon the patient's age, condition, the grade of the prolapse, we have to confirm that what can we do in that stage.
Okay, one thank you.
Okay. Deepika, have you have any doubt?
Yes, ma'am. Ma'am, today actually there was a case, 28-year-old female. She had irregular cycles initially before marriage, 6 months of marriage, and now it's been 46 days amenorrhea. So she had come day before yesterday. I checked her serum beta HCG. It was negative for pregnancy, and thyroid was 5.59. So, and for such kind, and she wants to conceive now, she's 28 years. For such kind of patients, ma'am, because this borderline thyroid, and her mother is a patient of thyroid, so most probably, and she's gained weight up to 7 kgs in the last 6 months after marriage. Now to this kind of case, what specific yoga can you advise, ma'am?
Actually,
Otherwise she's healthy, no other issues.
issues. Okay, first of all, we have to manage her lifestyle. Of course, that food pattern and all. The hereditary is also another factor here. And in addition to that, we can give, she will be having stress or anxiety. If she is having, just mind that, and you can give meditation for reducing her stress and anxiety. That's breathing techniques. And also, if you come to yogasanas, Malsyasana, um, if she is able to do the shoulder stand or halasana, that will be beneficial. But first of all, the aim should be to reduce her weight.
Yes,
Along with the
ma'am.
meditations, you can,
Actually,
along with the
she was
meditations,
around,
even
yeah, she was,
simple sun salutation, if she knows Surya Namaskara will be beneficial for her. First start with that along with the medications, then check how she is responding.
yes, ma'am. Ma'am, such kind of thyroid issues, basically from 5 to TSH ranging from 5 to 10, is very common. And one who have not started the medications, usually, as far as what I have gathered, according to my knowledge, as far as now, I just advise them Ujjayi, Shitali, and Brahmari Pranayama. Apart from that, will anything be useful, ma'am, before they have started the anti-thyrox before they've started the thyroxine? Like these are fresh cases, which we
How is their stress level?
stress level for this particular patient, there's no stress level, ma'am. She's a housewife itself and no issues.
Okay.
She's all fine. No, not that kind of stress level.
You
And
can do her Nadi Shodhana will be beneficial, and just start with Surya Namaskara practice. Increase the sets. Start from 3 set. Slowly increase the set. How her body is responding. Is there any changes? Then include light asanas. Gently go to intense ones. That may help, because I'm not seeing the patient and just hearing the condition. I can't suggest completely what can be done.
yes, ma'am. And weight is, it was like 58 kg, she said, before 6 months. Now she's gone up to 64.
So, first of all, I have to correct the hormonal imbalances, the lifestyle. If she's having a sedentary, being a housewife, if she is having a sedentary lifestyle, just ask her to start exercising.
Yeah. Yeah, that is the usual advice I say. I said, don't sit for half an hour more than in a day. As soon as you
Because,
find that you're sitting
the
for
thing
more
with the
than half an hour,
housewives,
keep
they
moving
think,
about.
yeah, they think they are doing all the household chores. Then why should we do exercise separately? But it is a mandatory thing. Check for her sleep cycle, food pattern, and all. Something will be there, which is
Yes,
not
ma'am. Yes.
You
Yes,
should.
ma'am. Apart from that,
But
Matsyasana and
usually we
Surya
can find.
Namaskara.
Yeah, just
Matsyasana
start
and
with
Surya Namaskara.
Surya Namaskara first.
Yes,
Slowly
ma'am. Yes, ma'am.
increase
Thank you.
legs. And then
Thank
go
you.
to other asanas.
And ma'am, one more common is during the perimenopausal and menopausal age, they usually have this sleeplessness, hot flushes. On a, matlab, generally, what can we advise for such kind of patients?
Doing Nadi Shodhana just before the sleep cycle, continuous practice seems to be helpful to improve the breathing pattern. Start with no breath retention. As the case improves, just include breath retention slowly and progressively only. And regarding the hot flushes, try to regularize the hormone, because the hormonal regulation is yet another long topic we have to deal with. And this cooling pranayamas will help along with
Yes.
our patients if needed. Here
Along
also,
with?
if needed, give medications. Just check for their food. Food part is a very important one, because diet plays an important role. Even the doctors, even if we ask for their diet, sometimes we will miss something. Sometimes simply by removing one thing they used to intake, symptoms seem to be improved. Have to check in detail.
Yes, ma'am. Thank you, ma'am.
Most welcome.
Okay, anyone else want to ask?
Yes, very good evening, Kamini ma'am.
Yeah.
Thank you, ma'am. It's very enlightened session. So, ma'am, I'm a strong believer that yoga is art of life, and yogasanas are totally scientific procedures. So, I used to add regularly to my patients this yoga and asana practice, whether she is a girl or a reproductive woman or a menopausal woman. Ma'am, in practice, I want to add that I have seen that some asana is very beneficial in gynecological diseases like for girls, PCOD, PCS. So first, Surya Namaskar Asan, practice of Surya Namaskar Asan, total 12 asanas. Paschimottanasana. Third one is the Mandukasana. Mandukasana plays a very good role for pelvic organs. Then butterfly asana, as you said, and the Setu Bandha asana. It increases the flexibility of backbone as well as the ligaments that are, you can say, that are supporting the uterus and the uterine structure, pelvic organ structure. Secondly, I think the techniques of breathing, the exhale and inhale, that is very important. That add on the benefit of asana. It acts as a catalyst for asanas. So practicing breathing techniques, as you ma'am, as you have given a very good session about meditation, that is also focusing and practicing our breathing. So we should teach our patients very specifically about breathing procedures along with the asanas. They give a better result. And thank you very much. Session was very good. Thank you, ma'am.
Thank you, Vandana ma'am, for the feedback and for the add-ons. Yes, regarding the Sedabandhasana, throughout the pregnancy also we are suggesting, depending upon the capability of the lady, and also regarding this pranayama, because there are different kinds of ratios and we have to consider each and every person, how is their breathing pattern and lung capacity. We have to start with a 1:2 ratio. If the patient is okay, we can include that retention kumbhaga state and all. It depends upon person to person. Thank you for the input, Vandana ma'am.
Okay. Anyone want to ask? And then we can conclude the session.
Sure,
Yeah.
ma'am. Thank you. Thank you for the opportunity.
Yeah, Pawan sir. Pawan sir है?
हरिओम जी बिल्कुल आपकी सेवा में मैं बिल्कुल आ गया हूँ होटल आने की देर पहले।
अच्छा।
जय हो, बहुत अच्छा सेशन रहा, प्रैक्टिकल रहा, अप्लाइड रहा और सबके काम आएगा। यू हैव मेड द डे मैडम धन्या जी, यू हैव मेड द डे। वी हैव रियली सेलिब्रेटेड योगा डे in different manner. Excellent. Kamini madam.
Thank you so much.
Kamini madam, kindly conclude.
जी. So thank you, Pawan sir. Thank you all the experts who were joined over here and participants who asked the question. And above all, thank to Dr. Dhania. And you have taught the meditation how to explain or how to guide our patients meditation session. It was very helpful for all the doctors. Thank you so much. See you again in future sessions. Thank you.
Thank you, ma'am.
Thank you. Thank you all. Thank you very much. Please do join us every day, 3 webinars after 1 week, but 1 webinar every day up to next week. Definitely, we will not miss any webinar and we will be on the time because time is different here in UK. So generally, it is missed during a workload in the morning. So definitely, I will not miss it. Thank you. Thank you all. Thank you very much. Thank you, Kamini ji, for inspiration. And thank you, Dhanya ji, for your nice presentation and guidance. Excellent. Thank you very much.
Dhanyawad.
Dhanyavad ji. Dhanyavad. Good night.